the government. To hear Democrats tell you it's about ObamaCare subsidies. Now, there's a lot of noise about those ObamaCare subsidies. Let's tune it all out and let's zoom in on the facts over at the wall. First, here's how ObamaCare works with insurance companies. It is a public program that is privately delivered. Healthcare plans are sold by private insurers, not the government. The federal subsidies help those insurance companies pay the premiums. The money goes directly to insurance companies on behalf of the enrollees. Now, why would they do this? Because they say it's shared cost, shared risks. Insurers agree to cover everyone. You remember the debate about pre-existing conditions. And then, therefore, the government helps to offset the risks to those patients. It's called a partnership model. And Obamacare didn't replace insurers. It made them partners. Now, that partnership has worked out very, very well for the insurance companies. They've gotten rich. They've gotten rich quick. Take a look at this graph. This is insurer stock prices since the advent of Obamacare. The orange line here, orangish yellow line, represents the stock price of big insurance companies. Just for an example, let's focus in on the green line, which is an S&P 500 ETF trust. You can see how much insurance companies have profited according to their stock price rather than your market selection since Obamacare was implemented. Now, while these stock prices skyrocketed, so too did the cost of healthcare-related services. Some of what has gotten more expensive over the last 25 years is represented on this graph. I know it's a lot of lines, and I know it's hard to see, but it's important, and I want to share this with you. Because if you look here, this is inflation over the last quarter century, since the year 2000. Overall inflation about 74%, this bold black line right here. Several different consumer items you can see have gotten less expensive over time, much less than the cost of inflation. For example, new cars, household furnishings, clothing, cell phones, computer software. Let's just take a look at one, for example. TVs. You and I both know, big, gigantic flat screens have gotten much cheaper over the last quarter century. In fact, they're down by almost 100% in price. Above the line, significantly above the rate of inflation, you have hospital services, up almost 300%. College tuition and fees, college textbooks. Do you see a theme to all of these parts of our economy? They are parts of our economy subsidized by the government. Everything, including average hourly wages, because the minimum wage law is nothing but a subsidy inside of the economy. And this teaches you something. If the government wants to make something more accessible and more affordable, it gets not cheaper, but more expensive.